Okay, this is our root cause analysis project. We're group 3, and our names are Aaliyah Wool, Kevin Harper, Chelsea Isom, Kimberly Johnson, and Carly Glisson. This is for our Essentials of Process Improvement class, and it's April 25th, 2021.
So we're going to start off with some definitions first, just to get going. And so one of them is adverse events, which means harm from medical care or intervention rather than an underlying condition. Error is any act of commission or omission that exposes patients to a potentially hazardous situation. A near miss is an unsafe situation indistinguishable from preventable adverse error, except for the outcome. A patient is exposed to a hazardous condition but does not experience harm, either through luck or early detection. If we were to apply this to a local event, some might consider the case of an elevated lab value, PTT, without overt bleeding a near miss, as no harm occurred, but others might say that the patient's body was affected and harm may not be recognized. So what it would be called would be a true adverse event. After reviewing this, we decided that this sounds like it falls more into the category of a near miss, as noted from the documentations from the emergency department nurse at 2317. PTT was 179 seconds, when desired range is typically from 50 to 70 seconds. Heparin infused held and no patient harm was noted. These were all decisions and definitions that helped us come to our conclusion in regards to our root cause analysis.
So this is our fishbone diagram for our presentation, and we started to build towards the harm from medical care rather than an underlying disease. And then from there, we built off 5 branches, being people, environment, communication, technology, and information system. And then from those big branches, we have little branches. And for instance, we can look at technology. And so our little branches are pharmacy software, IV pump, pharmacy equipment, computers, and lack of medication risk scanners. And then from those little branches, you ask why does this relate to the harm from medical care rather than an underlying disease? And then so if you look at pharmacy software, our why is out of date software, and also can't see medication unless chart is signed by an ER nurse. So that under each little branch will be the why for why it is related to the harm from medical care rather than an underlying disease. And then so now for our questions, understanding the problem with the process maps and timelines. Process maps and timelines, depending on the type used, can affect how providers cite quality and safety concerns. Each situation in healthcare can require a certain type of outline, whether that be process maps or timelines. Quality and safety concerns cited by practitioners differed depending on whether or not they were looking at process maps, which then this basically limits what a provider is able to say in each diagram. Then when you're understanding the fish diagram, like in our slide above, the fishbone diagram identifies many possible causes for an effect or a problem. For instance, a fish diagram's purpose could be to see what causes the harm for a provider's care. From there, you can build off with different scenarios that build up from provider's care with the end goal of having a complete diagram of minor situations that add up to create the outcome.
So for the root cause analysis, basically we just looked at the events that occurred or the problems that occurred and what action could be taken in order to fix these problems. So some of them we decided were the computer program prevents anyone from seeing the chart notes until they are signed. And so a way that we can fix this is by contacting IT in order to have the settings changed so that anyone can see the notes, whether they are signed or not. The handoff protocol was also neglected in this study, and therefore no records were present in the chart. And so a way that we can fix this is by ensuring that all of the records are documented with the handoff orders and that we do not skip the handoff protocol.
For the hierarchy of actions, we looked at the action, the system issue, and the solution. One of the weaker ones we found were double checks, with the system issue being the policy and there being no distraction rule as a solution. Getting closer to stronger, we looked at checklists. The system issue was human error, and then the solution would be being able to immediately view the charts. One of the stronger interventions would be architectural changes, which would be changing the technology and bringing in the bracelets that could be scanned to give medications.
This is our impact and effort matrix. And the bottom, it's the F of the solution, and then going up the y-axis, it's impact of the solution. So is it a high impact? Is it low impact? Okay. So in the lower left, we have the quick fixes, and that would be to streamline, to simplify the process, checklist, no distraction policy, a new chart policy, and maybe some new policies in general. And then next to that, we have kind of the ones you want to avoid, and those are low impact and high effort. And those are things like double checking or training. Above that, we have the things we want to evaluate. Those are things that usually are more expensive, take more training, and those things are like the IV smart pump, the architectural changes, and force functions. Next to that, we have immediate, like the quick fix, like what are we going to do right now? And that would be something that is a high impact with a low effort. And that would be remove restrictions so the chart can be seen, standardized process, wrist bracelet scanners, and enhanced documentation.
And then these are our references that we use to go over our root cause analysis. And we just thank you for taking the time to listen to our presentation today.
Thank you.